Hello, everyone. This is where we challenge popular opinions, question everyday beliefs, and have honest conversations about the issues that affect our everyday lives. Today's discussion is emotional. It is painful, and for many Nigerians, it is deeply personal. Today's topic is caught between the oath and the bill, when compassion meets the cost of healthcare. Let me tell you a story. A young man was rushed into the emergency room after a terrible road accident. He was unconscious, bleeding heavily. Every second mattered. The doctors knew it. The nurses knew it. Everyone in that emergency room knew one thing. If treatment didn't begin immediately, he might not survive. A few minutes later, his wife arrived, barefoot, carrying a crying baby in one arm. Still wearing the clothes she slept in, she was shaking, crying, begging, "Doctor, please save my husband." The doctor asked a simple question. "Do you have anyone else coming?" She nodded. "They're on their way." "Do you have any money?" She lowered her head. No health insurance, no savings, no wealthy relatives, just hope. The doctor looked at the patient, then looked at the hospital administrator, then looked back at the patient. One life, two impossible choices. Start treatment immediately and risk breaking hospital policy, or wait for payment and risk losing a life. Tell me, what would you do? This isn't a movie. This isn't fiction. This is the reality many Nigerian doctors, nurses, patients, and families face every single day. We often say doctors should save lives first. Morally, that sounds right. But let's ask another question. Who pays for the oxygen? Who buys the blood? Who pays for the medicines? Who maintains the ventilators? Who pays the nurses who worked all night? Who keeps the lights on when there is no public electricity and the hospital survives on diesel? Hospitals don't run on compassion alone. They also run on money. Now let's look at the other side. Imagine watching your child struggle to breathe. Imagine your mother having a stroke. Imagine your husband bleeding after an accident. Then hearing the words, "A deposit is required." At that moment, you don't hear hospital policy. You hear time slipping away, and time is something nobody can buy back. This is the painful contradiction. Nigeria is home to some of the most hardworking and dedicated healthcare professionals you'll ever meet. Yet, it is also a country where millions of families live from one salary to the next, or from one day's income to the next. Many households have no emergency savings. Many have no meaningful health insurance coverage. A single hospital admission can wipe out years of hard work. Some families sell their land. Some sell their cars. Some withdraw their children's school fees. Some borrow from neighbors. Some run to churches and mosques. Some post account numbers on social media, begging complete strangers to save a life. And while all of this is happening, the patient is still waiting. So let me ask you something. When a family cannot afford treatment, who has failed? The doctor, the hospital, the government, the health insurance system, or all of us? Now let me tell you what many people never see. The public often believes the doctor is the one refusing treatment. Sometimes, the doctor wants to save the patient more than anyone else. But the doctor does not own the hospital. He doesn't make the financial policies. He doesn't control the accounts department. He doesn't decide who gets treated on credit. Many doctors have quietly started emergency treatment because they simply couldn't watch a patient die. Some have pleaded with hospital management. Some have signed undertakings, promising the family would return to settle the bill. Some have personally bought drugs for patients. Some have paid for laboratory tests out of their own pockets. And sometimes, the patient survives, the family disappears, the bill remains. Who pays? Sometimes the doctor who showed compassion is queried. Sometimes the nurse is accused of violating hospital policy. There are healthcare workers who have faced disciplinary action because they chose humanity first. Then there is another issue: health insurance. On paper, it sounds like the answer. But many Nigerians tell a different story. Some people have benefited from it. Others say the coverage is limited. Some consultations are covered. But many prescribed medicines, investigations, or procedures still have to be paid for separately. Some patients are told the medicines they need are unavailable and are advised to buy them elsewhere. For many families, the insurance card they hoped would protect them still leaves them paying substantial amounts out of pocket. So the question becomes, is healthcare really affordable? Or have we simply created the appearance of affordability? Now, let's talk about private hospitals. This is where emotions usually take over. Whenever a private hospital asks for a deposit, social media explodes. They're wicked. They only care about money. But let's slow down. A private hospital pays salaries. It buys diesel. It buys oxygen. It imports equipment. It purchases drugs. It pays rent. It pays taxes. Everything costs money. If 10 patients receive treatment and none of them pays, how does that hospital survive? How does it pay its nurses? How does it buy the next oxygen cylinder? How does it remain open for the next emergency? Now compare that with many government hospitals. Despite public funding, patients still complain about overcrowding, long waiting times, equipment shortages, drug stockouts. If government hospitals, supported with public resources, still struggle to provide affordable and accessible healthcare for everyone, why do we expect private hospitals to carry a burden that even the public system struggles to carry? Please don't misunderstand me. This isn't about defending every hospital. Some hospitals have acted without compassion. Some healthcare workers have behaved unprofessionally. Those stories are real. They deserve accountability. But there is another truth. Many doctors go home carrying guilt. They remember the patient they wanted to save. They remember the mother who begged. They remember the father who couldn't raise the deposit. They remember the child whose treatment was delayed while relatives searched for money. Not because they lacked compassion, but because they were trapped inside a healthcare system filled with impossible choices. Perhaps we've been blaming the wrong people. Perhaps the real question isn't, why did the doctor ask for money? Maybe the real question is, why have we built a healthcare system where doctors must choose between their oath and the hospital bill? Because no doctor should have to choose between saving a life and saving their job. No nurse should have to fear disciplinary action for showing compassion. No patient should have to choose between treatment and bankruptcy. No family should have to sell their only house before a loved one can enter an operating theater. Compassion is free. Healthcare isn't. And perhaps the greatest tragedy in Nigeria is that we've built a system where we expect doctors to provide the first, while somehow finding a way to pay for the second. So, I'll leave you with this. If you were the doctor on duty that night, would you save the patient first, knowing you could lose your job, face disciplinary action, or become responsible for a bill that isn't yours? Take a moment before you answer, because your answer says as much about our healthcare system as it does about you. I'd really like to hear your thoughts. Leave your opinion in the comments. Let's have that conversation. If this episode challenged the way you think, don't keep it to yourself. Share it with someone, because conversations like this are how change begins. This is KCK Podcast, where we explore the truth behind everyday issues. Until next time, take care of yourself, take care of one another, and remember, a healthcare system should never force compassion and survival to compete. See you next time whenever I am invited.